So we have functional communication training. So that is essentially just teaching kids to use their words to communicate their wants and needs, whether that's them vocally saying it, whether it's using sign language, a picture exchange system, them even writing it down. There's a lot of different ways you can communicate, even communication devices. And so with that, oftentimes the problem behaviors kids engage in is because they're communicating something. There's a reason why we see these behaviors. So oftentimes if we can teach them the right words to say, if we can give them the language, then that often replaces the problem behaviors. Because if they realize like, oh, I can just say, I want my iPad, they get the iPad versus having to go up and draw on the wall or do anything else like that. And so with that though, that's when we get into we need to figure out what is the function of behavior, what is our kiddo trying to say right now, and then teach them that appropriate language to use in that event. And as we know too, out in society, that's going to work a lot more when they can communicate their wants and needs. So obviously, you guys are their parents. You know their behaviors. You know probably why they're trying to do that behavior or trying to get something. But anyone else in society may not know that. So you always want to make sure that they can use their words to indicate their wants and needs. That way anyone would be able to step in and help them out in that case.
Is that effective, you're talking after the behavior, or is this something in the behavior trying to get them to, because I had an issue with my son last night where he was just, this is mine, it's mine, it's mine, it's mine, and I'm trying to talk to him calmly, trying to get him to use some kind of word to tell me, but it was at a loss.
It was lost,
Right, so I mean, how effective is this during behavior, or is it really meant for after the fact? Because I don't know if he's going to remember to try to do that when he's in his moment.
In the moment,
next time around.
Yeah, so I'd say definitely in the moment it's not going to work. So it's something, which I'm not sure this shows up on the later slide, but often we see those precursor behaviors. So we may see a little bit of a protest, a little bit of a grunt, a scowl, a look that your kiddo gives. They know, oh, they gave me a look, now we're about to go on full-blown tantrum. At that point, if you can intervene at those precursor behaviors, that is an opportunity to try and teach that language. You know, when you're in that behavior, they're not in a state to be able to learn. And just think about because I know me, when I'm mad, the one thing that is guaranteed to make me more mad is if someone tells me to calm down. Oh, you want me to calm down? Okay. So in the moment, it's not going to happen. But then after, that could always be something, once they've de-escalated, calmed down, then you can always revisit and talk about it. Oh, you were saying it's mine. You could have just said, it's my turn. And kind of do that teaching after the fact. But yeah, during it, in the middle of behavior or not, they're in too heightened of a state to even be receptive to what you're saying. And if they do repeat what you say, they're just repeating what you say.
Yeah, because
it's not like it's registering.
He's still not getting out what he really wants to say at that moment. So I didn't know if that was teaching him to be able to do that, or if it's something after.
Yeah, so ideally you can catch it before or do it after, but during, probably not happening. That's a good question. Thank you. So these are some different procedures that we use to teach skills. So prompting, we've already talked about, different ways to prompt things. Avoiding prompt dependency, talked about that as well. So we have task analyses. So these are big steps. So it could be washing your hands, brushing your teeth, tying a shoe. Those bigger skills that can be broken down into easy, smaller steps that can be taught. So that could be one way that we use a task analysis, different ways of doing that. You could do a forward chain and backward chain, total task. That, pretty much all of these could be their own presentation as well. So that's task analysis, just taking those bigger steps, breaking them down, and teaching each individual step of that behavior chain. Then we also have shaping. So shaping is similar to task analysis, but different. So with task analysis, we're actively teaching a big step, breaking it down to smaller steps. With shaping, that's focusing on one specific step. So I know we use it oftentimes with food is a way. So if you have a kiddo who they need to eat their carrots, they hate carrots and they're not doing it. So to shape that behavior at first, like, hey, touch a carrot, good job, you touched a carrot, it's gone. Next day, pick up the carrot, oh, awesome job, you picked up the carrot, now it's gone. The next day, it's you pick up the carrot, put it to your mouth, oh, it's gone, great job. Put up in the carrot, lick it, oh, great job, now we're done. And you slowly increase the expectation until we get that desired behavior of you actually eat the carrot. So that's shaping, which is used in task analysis as well to teach each individual step. And then we get into generalization and maintenance. So with our behaviors, obviously we want our skills to generalize across different people, across different environments, across different stimuli. As you know, oftentimes we hear as ABA therapists like, oh, well, yeah, my kid's great with you. They listen to you, they respond to you. Now they don't listen to anything we say. So that indicates then that that skill is not generalized across persons. Yeah, they listen to me, that's great, but how I'm going to be in their life for what, 2 to 3 years? They need to listen to you guys. So that's when we want those skills to generalize across different people. Also across environments. As we know oftentimes too, kiddos act one way at home, totally different at school, totally different than out at grandparents' house, which is different from how they act at Publix. So across different environments, we see different behaviors as well. So we want those skills to generalize across all those environments. The last one is across different stimuli. So if I know this is a remote, but I also know remotes can look differently than this. So that's just to generalize that skill across different stimuli that, yes, a corgi is a dog, but also a golden retriever is a dog, a lab is a dog. So that's how we can generalize across different stimuli. And then we want the skills to maintain over time. So the end goal is that all these skills build on each other and they last throughout the kiddo's lifetime. We don't want to teach them a skill, yay, they can do it for 2 years, we stop teaching it, and then they forget it, they stop doing that skill. So we always want to make sure they generalize across those people, places, and stimuli, but also it maintains over time. Thank you. Oh, so I got some questions for you guys. So you guys are lucky you're doing it in person. Nana's about to pass out the questions for you guys. You can just fill them out. Should be pretty easy. But for our folks watching online, when you do watch it, just watch the video. We'll be sending these questions home in your kid's backpack. Just fill them out, turn them in, and then you get credit for this. So this, a nice little scenario. So Katie asked for a cookie, and her dad told her, not right now. Katie screams and falls to the floor crying, and dad gets her a cookie, so she won't wake up her sleeping younger brother. Which, as you know, as a parent, you get it, like, baby sleeping, please just be quiet, take the cookie, be quiet. So it makes sense why the parent did that. But so I want to know, number 1, what was the antecedent to Katie's engagement in prowling behaviors? Number 2, what do you believe is the function of the prowling behaviors? And then 3, will this be an example of reinforcement or punishment for Katie's screaming, falling to the floor, and crying behaviors? So I'll let you guys take like a minute or 2, get those filled out, and then we'll talk again.
That task analysis and the shaping.
Yeah.
Because I know I have different instances with both my kids. They're different. They're night and day when it comes to them. So, yeah, I think that right there.
Perfect. Yeah.
What about like this is not something that you talked about, but I actually have a couple of that are.
Oh yeah, definitely.
But one of them is like what is the appropriate thing to do like when they are in a heightened state of being upset? You know, like what is the best response like in a public place versus in the home? You know, because obviously if they're having a tantrum in the middle of Publix, like what should I do versus if they're having a tantrum at home, what should and then another one would be, and I think I've mentioned this before, but puberty addressing.
Yes.
Thank you.
That's fine. Yes, I do have videos. I can send you guys some video links that I found. Yes. That's a fun ball game. Always a fun time.
Yeah. I mean, it's a fun ball game no matter who the kid is, but when they don't understand what's going on. And the response is, but I just want to stay home forever.
It's like, oh, don't we all, kid? Right? Yeah.
I understand.
Yeah, that's definitely a scary topic as well. Yeah. I have some good ideas to move forward. And like I said too, at any point, if you guys happen to think of something, feel free to reach out, like I said, to any of your BCBAs. For anyone at Rockledge, we got Brittany Bogansky back there, clinic director. So if anyone wants anything at Rockledge, any questions, feel free to reach out to her. Any non-clinic parents as well, definitely feel free, either like reach out to any of us or Mrs. D, and she'll let us know.